Are you experiencing pain in your lower back due to disc herniation, sometimes called a slipped or ruptured disc? I'm going to tell you what it is and give you some solutions for it. So stick around because these tips are going to lead you to a pain-free life and put you on the road to recovery. This video will cover anatomy, the latest research, and a structured rehab plan. It's a detailed guide, so feel free to use the timestamps to jump ahead to the sections that interest you the most. So your spine is made up of vertebrae, and between each vertebrae sits a disc. These discs act as cushions, absorbing shock and allowing for movement. Each disc has two components: the nucleus pulposus, a gel-like center that provides flexibility and absorbs impact. The annulus fibrosus, a tough outer layer that keeps the nucleus in place. Discs are most commonly found in the cervical, neck, lumbar lower back regions because these areas handle the most movement and stress. When a disc herniates, the nucleus pushes through the annulus and potentially pressing on nearby nerves, which can lead to pain, weakness, or numbness. So what exactly is a disc herniation? A disc herniation refers to a condition where part of the nucleus pulposus bulges out through a tear or weakness in the annulus fibrosus. Depending on the location and the severity of the herniation, it can irritate nearby nerves, causing symptoms such as lower back pain, radiating pain into the leg, also known as sciatica, numbness or tingling in the extremities, muscle weakness, which can occur when nerve compression is severe. It's important to note that not all disc herniations cause symptoms. In fact, imaging studies often show herniated discs in people with no pain or functional issues. So why does a disc herniation happen? Well, disc herniation usually results from a combination of wear and tear and specific incidences. So let's break it down. Number one, degenerative disc disease. Over time, discs lose hydration and elasticity, making the annulus more prone to tearing. 2. Acute injuries. Lifting something heavy with poor form, twisting suddenly, or a traumatic event can cause a disc to herniate. 3. Lifestyle factors. Prolonged sitting, poor posture, smoking, and being overweight can increase the risk by putting extra strain on the discs. For many, it's not always about a single moment or injury. It's the result of cumulative stress on the spine over time. Terms like slip disc or ruptured discs are often used interchangeably with disc herniation, but they don't fully capture the condition. Instead, the term disc herniation is preferred because it focuses on the structural changes in the disc. In some cases, you might also hear terms like protrusion, a mild bulge of the disc, extrusion, when the nucleus breaks through the annulus, sequestration, when disc material separates entirely and moves into the spinal canal. Understanding these distinctions is important when working with healthcare providers to develop the best strategy and treatment plan. One of the key insights from modern research is that imaging doesn't always correlate with symptoms. A herniated disc seen on an MRI doesn't automatically mean you'll have pain and vice versa. Instead of focusing solely on the MRI results, it's crucial to focus on improving movement patterns, reducing symptoms, and gradually building resistance. This is often summarized as a treat the patient, not the picture. Pain is complex, and it's important to approach it thoughtfully during recovery. Disc-related pain can fluctuate, but monitoring and managing it is key to making progress. So here are a few helpful strategies that I've used. Understand pain levels. Use a 0 to 10 scale during and after activities. A tolerable level is said to be around 3 to 4 out of 10 during rehab, as long as the symptoms don't worsen significantly the next day. Monitor post-activity symptoms. After exercise or daily activities, ask, did my pain improve or stay the same or worsen? Am I feeling more or less capable today? Adjust when necessary. If you consistently experience flare-ups, scale back intensity or frequency or duration of activities. On the other hand, if things are going well, gradually challenge yourself with more. When it comes to disc herniation, people often fall into two camps. Number one, avoiders who do too little out of fear of pain, leading to further deconditioning. And two, the pushers who ignore the pain and repeatedly overdo it, causing more setbacks. Neither approach is ideal. Instead, focus on finding the Goldilocks zone, enough activity to challenge yourself without overwhelming your system. Consistency is key, and recovery may take weeks or months, but gradual progress is the way forward. Rehabilitation for disc herniation often follows a structured progression. For stage 1, for example, pain reduction and core activation is something we focus on. Why? To reduce pain and build a foundation for movement. Some examples could be supine pelvic tilts, Mackenzie extensions, gentle cat-cow movements. In stage 2, we're looking at strengthening and stability. Why? Because building strength in the core, back, and hips help to support the spine. Some examples include bird dogs, side planks, glute bridges, which is my personal favorite. In stage 3, we look to introduce functional movements and loading. Why? Well, the goal is to gradually reintroduce more dynamic movements and loads. For example, including some deadlift variations with very light weights. Do some farmer's carries or squats and lunges with controlled depth. And in stage 4, our goal is to return to full activity. We want to safely transition back to work, sports, or other demanding activities. Maybe we're looking to do some sport-specific drills, to do some plyometric exercises. Maybe we're looking to do some progressive loading tailored to your needs, and so on. Here's an example of a weekly schedule that can really support you on your journey. Maybe on Monday, practice core stability exercises and pain reduction poses. On Wednesday, focus on strengthening exercises, focusing on back, core, and hips. On Friday, bring in functional movements like squats, lunges, and carries. You guys can mix it up and match it based upon your own tolerance and progress. Remember that less is more, and gradual progress is always preferred, but progress nevertheless. For instance, stage 1 exercises can overlap with stage 2, allowing you to continue pain management while building strength. A question often asked is, do you have to stop everything in your life? And the answer is, it depends, and not necessarily. Movement is medicine, and staying active is crucial. While you might need to modify or temporarily avoid certain activities, the goal is to keep moving within your limits. Activities such as walking, swimming, or cycling are great low-impact options to maintain overall fitness. And remember, if something consistently triggers pain, consider consulting with your healthcare professional to adjust your approach. Here are other management strategies beyond exercise. There are additional ways to support your recovery. Let's check out ergonomics. Optimize your workstation to reduce strain on your lower back. Manual therapy, massage, or spinal mobilization might provide temporary relief, but they're not the replacement for exercise. Heat or ice, use them for short-term symptom relief. Mind-body techniques. Practices like yoga or mindfulness can help manage the psychological aspect of pain. That said, these are adjuncts. The core of recovery remains consistent exercise and progressive loading. Disc herniation can be challenging, but recovery is absolutely possible with the right plan. Focus on movement quality over fear of imaging results. Progress through rehab stages from pain reduction to full activity. Monitor your symptoms and adjust as needed. Be patient and consistent. It's a journey, not a race. Friends, thanks so much for joining me on this deep dive into disc herniation. If you found this video helpful, hit that like button, subscribe, and leave your questions below. Remember that this video is for educational purposes only. Always consult a healthcare professional for personalized advice. Take care, and I'll see you, friends, in the next video.